The pandemic has basically put life on hold. For many, at the trickiest time of life, adolescence. You can't stop a teen from growing up or developing, but the concern in isolation is that they'll develop in the wrong direction. Psychologists warn of a global surge in mental disorders. On the cusp of adulthood, young people are seeing their chances of a future eroded. The effects could be lasting.
They're meant to be focusing on their education, exams, uni, an apprenticeship, getting a job. A lot of really important life-changing decisions, while locked down under a cloud of uncertainty and fear created by the coronavirus. Life just got really hard for some.
Lucia is 16 years old and lives in Sevilla, Spain. Her life has changed dramatically. At her school, in-person learning only takes place in small groups. The rest is online.
We used to meet more people. Now I just go around in a small group of friends. We used to go to the movies, but we don't do it now because of the risk. We used to go everywhere by bus. Now I only walk. Everything has changed. Everything's harder now.
Still, she says she understands why the rules are in place.
We do have grandparents and older people in the family. That's why I don't think the measures go too far. They're for something good.
Nat lives in the Polish capital, Warsaw. The pandemic's constant stress and worry, as well as social isolation, have taken a toll.
I suddenly had symptoms of anxiety disorders and developed tics. Acquaintances have told me that they have psychological problems and anxiety from the constant uncertainty.
Politics are a big interest. Last summer's presidential race saw Nat get involved in LGBT activism. That helped.
My sense of activism was reawoken because of the pandemic, and that's a great thing. There were presidential elections during the pandemic, and there was so much hatred directed at LGBT people.
Tara is 18 and lives in London and is also finishing school. She wants to go to a highly selective theatre academy. She's dreading the fall and winter months.
We can't just meet each other outside anymore because it's so much colder, and we can't go to each other's houses, and I think that I really miss seeing my friends and going to parties. And I know it sounds like, oh, but I'm not going to be able to see my granny at Christmas, and my family aren't going to be able to go and visit her, and she's going to be on her own. And so it's just all these different things that just make it such a rubbish thing to deal with.
She says the government doesn't have young people's mental health in mind when it makes decisions.
As you know, the government just thought, right, let's just shut everything off that makes young people happy and gives them like things to enjoy and things to like escape from their lives from, you know, like parties and just have a bit of fun, which is what like makes being, I think, a young person so fun.
Fun, parties, adventures, simply sitting in a full classroom. It's all out of reach during this time of isolation, with no end in sight yet for young people.
Julia Arzbrandt from Berlin's Humboldt University is a psychologist and works with children and teens. Can you list us through the most common issues young people are struggling with right now?
Well, there are actually a couple of problems that they are struggling with. One of the most important ones is, of course, anxiety. They are worrying about everything right now, their future, the virus itself, and so forth. But they are also experiencing depressive symptoms. They have problems with conflicts in families and, of course, sleeping problems, eating problems, all this kind of stuff.
So how's the pandemic amplifying those problems?
Well, the problem is that the pandemic itself and, of course, the restrictions that follow along, they increase the stress on children. And we know from research that stress is one of the main factors for developing mental health problems. And, of course, now we have this huge stressor, which is the pandemic and the restrictions. And it's kind of normal that children, youth, and adults all experience more mental health problems, even though we do not know if they will eventually have a mental disorder or how they will cope in the long term. However, at the moment, we see sort of a double of symptoms in children and youth.
What determines whether these problems do develop into disorders, though?
There are a couple of factors that amplify the stress. One of them is most importantly the background of the children. So, are they vulnerable to stress? Do they have had family problems before? Did they have mental disorders before? Do they have support in the schools, in their social life? And of course, it also depends on the length of the pandemic and the restrictions. We expect them to show increased problems even after the pandemic, sort of a delayed onset. But we are quite certain that we have not reached the full height of the mental health problems in the pandemic.
Is it very much dependent on what sort of parents you have and how they react?
Well, that's certainly one factor. There's been a study in Australia where they showed that one of the most important things for the development of mental health problems were the conflicts in families. And of course, if the parents are stressed, then you have conflicts in the family, and that increases stress on the children. So one important factor is how the parents are coping, but there are other factors as well. It's also how well the children are involved with their friends, how much support do they receive from others, how much other support do they get, for example, from schools. So parents are one factor, but not the only one.
So I guess it's important that the schools stay open.
Yes, I'm very happy that right now in Germany schools have been staying open, and I hope that this stays that way, because what we saw during the first lockdown in many countries was that children were struggling a lot with the lack of structure during the day, with the lack of social contacts, with the lack of support from their teachers. And so I think that this is really one very important thing for mental health, to leave schools and all daycare facilities open, if it's possible concerning the pandemic restrictions.
Sure. Julia, how else can we avoid melancholy or loneliness or isolation turning into something worse?
Well, one thing is to be starting to be a bit more creative. We know that social support is one of the main factors to decrease mental health problems and to decrease stress. So, of course, a lot of people think we need social support from real life interactions, but of course we can use digital setups. We can try to find positive reinforcements in our everyday life, to experience things that are helpful to us, have like the little things in life that you enjoy, and of course try to share these with other people. So that's one thing how we can try to manage the stress to decrease stress. On the other hand, it also depends a lot on the perspective that you have on problems, and of course you can sort of go into a downward spiral and think about all the things that are bad right now, or you can try to focus on the nice things during the day. Just be thankful for one thing at the end of the day.
I'd rather focus on the nice things too. Julia Arzbrand from Berlin's Humboldt University, thank you very much for joining us today.
Thank you.
Some very good advice. Your questions now on the coronavirus is DW Science correspondent Derek Williams.
I'm curious about differences in COVID-19 infection rates seen in primary versus secondary schools. Are there studies on that?
There's a real jungle of conflicting data on this topic, and pretty much any other question that you can think of that's related to kids and this pandemic. So let's start with what seems at least mostly clear at this point. First, several studies, including a few big ones, have shown pretty convincingly that infected kids can also transmit the virus to others. But the data also looks pretty strong that A, kids are more likely to get it from adults than the other way around, and B, that smaller children in particular, so those under 12 or so, are a lot less likely to transmit it to others than older children or adults. The European Center for Disease Prevention and Control has emphasized that unlike with other respiratory diseases, there's no evidence that kids are primary drivers of COVID-19 outbreaks. One of the big problems with trying to compare primary to secondary school kids to find out how big the differences between them might be is that every study decides what the word child means on its own. One might look at anyone under 18. Others might only look at kids in preschool. If you want a comprehensive roundup of what we know so far about kids and COVID-19, I highly recommend looking at what the WHO has published on it. Its info pages are connected to a very, very wide range of subjects around the topic. Everything from what I've talked about here to how closing schools affects children's welfare. And you'll also find more studies there on children and COVID-19 than you can shake a stick at.
Time to bring you up to date with the latest data on COVID infections from more than 200 countries and territories.
The numbers show new cases doubling in 39 nations and increasing in another 81 countries. They've stayed at the same level in 16 countries. 61 nations have seen their new positive COVID-19 cases decline. Another 8 are down by at least half. And 6 countries have reported no new cases for 4 weeks in a row. Here's the bar graph showing the statistics of the past few weeks. The fight against the coronavirus will be over when that whole chart turns blue, so it's going to take some time.